Alex Earl. We're here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. So that's right, Hump Day. This is where you get, this is kind of your primary source for reliable plastic surgery information. It's the time that we get to spend with each other. Of course, like we can go over several plastic surgery topics and answer all your questions. Okay. So today I wanted to go over something that we haven't talked about in a little while. I wanted to go over the Mommy Makeover. Okay. So I kind of want to define that, kind of, let you know what it is exactly, what kind of options you have, and what kind of options you don't have actually. And then we're going to get into, the different parts of that procedure, including the trifecta perfecta, which is when you add the arm lift to the Mommy Makeover, which is also a possibility, okay? But there seems to be a lot of confusion out there, even today, as to what exactly is a Mommy Makeover, what can be done, what can be combined, and what can't, okay? So the typical definition for the Mommy Makeover is a combination of a breast surgery with a tummy tuck, okay? So those are kind of the two components that are most affected by pregnancy. That's where the term comes from. So of course, pregnancy is going to affect the belly as everything gets stretched out. It typically causes loose skin and also weakness of the abdominal wall or a separation of the abdominal wall muscles, which is called diastasis. Okay, and then so the tummy tuck kind of takes care of that part. And then of course with the engorgement of the milk for the breast, and then after that, followed by the breastfeeding, and then all the hormones kind of coming back into balance. Once you're done breastfeeding, typically the breast initially gets larger and then it kind of comes back down, and when it goes through that whole process, it typically ends up more tautic or more droopy, and a lot of times with less volume, so kind of like an empty breast type of syndrome. So that's where the term comes from. So when you think about Mommy Makeover, think about breast and tummy, okay? So in terms of the breast surgery, it can be any breast procedure that basically the patient needs. So if you have a relatively small breast with not a lot of droop or ptosis, then it can be the breast augmentation, okay? And then of course, if say you have the droop, you have the ptosis, but you have a fair amount of volume still, then a lot of times you can do just a straight up breast lift, okay? There are some women, of course, that started off, even before pregnancy, with very large breasts that they want to reduce. So it can be a breast reduction. And of course, probably the most common one, the most typical one, is the combination of the breast lift with implants, for the reasons that I stated before. So typically, after breastfeeding, the breast becomes deflated. Not only does it become deflated, but it becomes droopy, and you lose a lot of volume, especially in that upper cone of the breast. So really the best way to try to fix that is with the combination of a breast lift and implants, okay? And then, just before I continue, one of the questions that we typically ask are like, what? Like, Dr. Earl, I've never had kids. Can I have a Mommy Makeover? Of course, the answer is yes. Okay, so it's not limited to only moms or people that have been pregnant, but it's really about that combination of improving the breast area and improving the abdominal or tummy area. Okay. So, like I said, it can be really any breast surgery there, and so there's a lot of choices there, and that's why. Some of the patients that kind of send in their information for quotes, they'll ask, what's the price for Mommy Makeover? Well, there's a big range there. There's a big range because these are all very different, right? Your breast tug, your breast lift with implant, or breast reduction. So depending on what you actually need here, of course, there's going to be a differential in the quote that you get, because this is a breast tug is typically less than, of course, say a breast lift with implants. Okay. And then yes, you're combining that breast surgery with your tummy tuck. So your tummy tuck, it's typically a full tummy tuck that we're doing with the Mommy Makeover. So the full tummy tuck is going to include, of course, your muscle repair or plication, okay? And it also includes, or part of that is the lipo to the flanks and the waist, okay? Yes, the incision is going to be from usually from hip to hip. We do have to release the belly button, so we have to create a new opening for the belly button to come out. So with your full tummy tuck, you'll have that little scar around the belly button as well. Okay, that's your typical or the most common type of tummy tuck that we do with a Mommy Makeover. But of course, can it be potentially a mini tummy tuck if the patient is a candidate? Yes, it can. Can it be an extended tummy tuck if the patient needs the extra incision length to get rid of some of the excess skin along the sides or the flanks? Yes, it can as well. Okay, so there's a few different tummy tuck combinations that you can do. So it can be, your mini tummy tuck, your regular, or full tummy tuck, and your extended tummy tuck. Okay, so once you kind of bring all those combinations into play, it could be multiple. There's multiple different combinations of breast surgery and tummy tuck that can be put together to become your Mommy Makeover. Okay, and then the lipo aspect of it. Well, the lipo that kind of comes standard with it is that lipo to the flanks and the waist. So the lipo to the flanks and the waist is typically this area here to try to accentuate that waist and create the figure. Okay. So a lot of patients will then ask, what should I do first, my BBL or my Mommy Makeover? These are, of course, patients that will need both. Typically, I'll say, do the Mommy Makeover first. Yes, we're going to do some lipo to the flanks and the waist, but the overwhelming majority of patients will have enough fat for their BBL. So don't worry about that. I know it's a very common question that we get. I always get asked, Dr. Earl, if I do my Mommy Makeover first, will I have enough fat for my BBL? Or if I do my tummy tuck first, will I have enough fat for my BBL? And the answer is yes. The answer is yes for a few reasons. Typically, we when you're doing the Mommy Makeover, we're not doing any lipo to the back at all, okay? And we're doing almost no lipo to that central belly area, right in here. So lipo's focused into this area. Not only that, but we're limited to how much we can do, because when you do the Mommy Makeover, we're limited to only 1,000 cc's of fat removal by the Florida Department of Health. Okay, so we're limited as to how much fat we can remove. We limit it to certain areas. So yes, you will definitely have enough fat for your BBL. So please don't worry about that. And typically, it's best to do your Mommy Makeover and your tummy tuck first, before you're doing your BBL, okay? I would say for over like 90% of the patients, that's probably the best way to do it.
And when you get liposuction with the Mommy Makeover, is it only to the flanks, or can you say, can I get it my upper back or anywhere else?
Right. So we're not going to be doing the back again. We're doing a lot of work in the front here. So typically the patient's going to be laying on their back, right, in the position that we call supine. So supine means you're laying on your back, and we're not going to be turning you over. We're not going to be twisting you around. So usually there's no lipo to the back with the Mommy Makeover. It's focused to the flanks and the waist. And then there are a couple of add-ons, like small area add-ons that you can do, which I put here. So what are your add-ons? Well, you can do a chin lipo. So you want to add chin lipo or face tight to the chin, then you can do that. Or you can also do arm lipo or body tight to the arm. You could add that on as well. Why those specific areas? Because they're small. The chin is mostly a contouring type of procedure, so there's very, very little fat removal. Actually, most of the times I don't even count it into my totals because it's so little actual fat that gets removed, but it's more kind of contouring of that area. The arms, yes, the arms can have a bit more in terms of the actual volume of fat that's being removed, but again, it's a relatively limited area. You're not adding, that much more. You'll still be, for the most part, for most patients, okay within that 1,000 cc limit. So it is typically okay to add these small areas here. But going back to that question, adding an entire back, no, I would not. I typically don't do that. I typically don't recommend that. That's a large area. It's a lot more fat. You're definitely going to go over your 1,000 cc's. So it's just, it's not convenient, and it's not, you're not going to get the best result if you try to do it at the time of your Mommy Makeover.
So when you're doing a Mommy Makeover, so it's breasts, lipo, the flanks, and a tummy tuck, what's your order of operation? How do you start the surgery, and where do you go from there?
Yeah, so typically, so there's an implant involved. I will always do that first, okay? So the implant is, of course, the part of the surgery that's the most sensitive in terms of you really want to have your absolute infection control, as much as you can, because as opposed to say just any wound. Typically, if a wound gets infected, you just treat it with some antibiotics, or sometimes you got to open the wound, but eventually it'll heal on its own. But with an implant, if an implant gets infected, then you have to remove it. And then you gotta remove the entire implant, you gotta wait like 3 to 4 months, and then even try to place an implant back in until that time. And so it's really much more a bigger deal, because then that's like 2 more operations, right? You have your Mommy Makeover, then you have your implant removal, then you have your implant placement again. So the implant goes first. So if we're doing an implant, so breast hug or breast lift with implants, the implant will go first. If we're doing the breast lift with implants, then we'll proceed to do the breast lift aspect of the operation, and then we'll finish up with the breast, and then move on to the tummy tuck portion of the operation.
Thank you.
If we're doing something like which we're then getting to an area that's like near the mouth, so to the chin, that's always going to be last. Okay, we want to areas that are more prone to having bacteria, are like the mouth and well, the other area which I don't combine here, but the area of course is the anus. Okay, so in some other places, maybe some other states or certainly some other countries like Dominican Republic or Colombia, they may combine a BBL with all this. I would be very, very careful with that. The BBL of course is near the anus, so the chances of bacterial infection are higher. Typically, I just, even if you go to a place where it's allowed, I really don't recommend it. I really don't recommend combining something that, with an implant with a BBL. Okay, the chance of infection is much, much higher. The chances that you have to, that you'll lose that implant are significantly higher as well.
You said for the Mommy Makeover, you can add chin lipo. Can somebody also add liposuction to the inner thighs or body tight?
You can. I mean, if the thighs are potentially an area, that one is a bit more variable, I would say. So if it's kind of a thinner patient and they just want to remove like a very specific targeted area of fat in the thigh area, and with some body tight, then sometimes we can do that and combine it. But if you have fairly large thighs, it's probably best to kind of not do it at the time of the Mommy Makeover, but when you come back for your Lipo 360 or your BBL. So for the most part, I prefer to do the thighs at your second procedure, at your Lipo or BBL procedure.
So specific question: I had a gastric sleeve surgery. I need arms, breasts, lipo, and a tummy tuck, and a BBL, possibly a back lift and a thigh lift because she's lost a lot of weight. Where should I start for my best results?
Exactly. So your situation is not uncommon. It happens a lot with our massive weight loss patients. Okay, so of course you've lost a lot of weight, and of course it's good. You're much healthier. But the downside to losing all that weight is that you have a lot of excess skin, and the excess skin can be in multiple areas. It can be the face, the neck, the breast, the tummy, the thighs, and the arms. So you can't do all of that at once. Okay, so that's the first thing you have to understand. So the first thing you have to understand is it's going to take 2, maybe 3 surgeries at least to try to get you to where you want to be. Typically, I'd like to start again with the Mommy Makeover. So the Mommy Makeover is going to be the breast, okay, whatever needs to be done there, the tummy tuck portion of it, and if you want to add the arms, then that is okay too. So we call that the trifecta perfecta, okay? Because that's basically 3 surgeries in one, right? So it's a trifecta. You're doing breast, belly, and arms, okay? So that can be added to the Mommy Makeover, in which case it would be a Mommy Makeover plus arm lift, which is called the trifecta. And so that can all be done at the same time, but that is the limit to what I will do at once here in my outpatient surgery setting. Okay, I don't like to have my patients under anesthesia much longer than 3.5 hours, and we can do all that because we're extremely efficient, much more efficient than many other places or many other surgeons, to be honest. So we can do that and keep it to a reasonable amount of time. A lot of times we don't even use a Foley. Because we can do that trifecta within 3 hours or so. So that would be the most that we can do in that first stage. If you're then thinking or needing that you need a Lipo BBL, that can be your second stage. With that, you can add any body type procedures that you need. So body type is something that definitely you can add with your BBL. Okay. Now, if you're needing, the one thing that I really don't like to combine with anything else is a thigh lift, okay? I don't like to combine that with almost any other procedure. I'd rather do a thigh lift on its own, because it's one of the most difficult surgeries to recover from, okay? So you have these long incisions along your inner thighs, and it's an area that we're constantly stressing because we have to walk, we have to move around. There's actually no way to, you don't want to get around that, right? Walking is incredibly important because you're still worried about your DVTs or potential blood clots, okay? So you have to walk, you have to move around, and then of course the upper part of that incision is near the groin area, which is typically a groin area that has a lot of moisture, okay, from sweat and everything else. And so what happens is that it's really not unusual at all to have issues with the incisions. So the incisions open up, open wounds, dressing changes, things of that nature. And the other thing that happens very commonly are potential for seroma. So even though you have the drains, sometimes after you remove the drains, you can potentially have a seroma. Also your lymphatic system is interrupted and everything else. So it is a difficult recovery overall. And so you want to be basically just focusing on that and not anything else. So like I said, it's not unusual needing to do a whole bunch of like dressing changes and things like that. And it may take over 2 months for things to like really settle and really heal. So so you can do a lot in your first stage. You can do your trifecta, again, breast, tummy, arms. If you're going to do a BBL, that's basically stage 2. And then stage 3, if you need it, would be your thighplasty.
Can you do a muscle repair without making the typical tummy tuck incision?
No. So not really. Is it physically possible? I mean, you can do it kind of like laparoscopically. It's extremely tough. Nobody really does that. So in order to do that muscle repair, you have to basically dissect the skin from down here all the way to here. So you need this whole thing lifted up, okay, so that you can get in there, okay, and do that repair. So sometimes you may see some patients that don't have a lot of excess skin. So really the main issue is not the excess skin, but the main issue is that they have a diastasis or muscle separation or a weakness of the abdominal wall. And so these are the patients that you sometimes see where their skin seems fairly smooth, they don't have a lot of stretch marks, but where they're just in their relaxed state, they look like they're still pregnant. And oh man, we get these patients and a lot of times they come in really upset because people will ask them, and you're not supposed to do this, people are asking, hey, how far along are you, or are you pregnant? And they get really upset because they haven't been pregnant for a couple years, but the issue is that their abdominal wall is weak, okay? And so then you still have to make that incision, you make that tummy tuck incision so you can get the exposure to strengthen that abdominal wall. Perhaps you're not removing a lot of skin, but it makes a world of difference to the patients, and they're usually very, very happy. But it gets confusing because you'll show the photo, the before and after, especially on Instagram and stuff like that, social media, where people are not too educated. They're not following us here on Hump Day. And they're like, oh, she didn't need a tummy tuck. She could have just done lipo. Well, lipo does nothing for a diastasis or a weak abdominal wall, okay? You're not addressing that at all. So you can lipo the fat that's between the skin and the muscle, and you can make that as thin as you want, but if you're not addressing that weakness of the abdominal wall, that patient's still gonna have that quote-unquote pregnant look, okay? Because the wall is weak and the guts, basically, the viscera, tends to want to push it out. And so they'll have that rounded belly look. And the only way to, address that is to do that muscle repair. Right.
I had a tummy tuck and I still have extra skin that causes a crease. What should I do?
Okay, so that's a pretty specific question. I would recommend that you basically send your information and photos for evaluation to see kind of exactly, what's going on and how much skin laxity there is. The one thing that I will say that is, of course, in order to try to maintain your tummy tuck, you don't want to go through some like big life-changing kind of behaviors after surgery. So, I'm not saying this is what happened to you, but that's why I really don't recommend a tummy tuck unless you're fairly certain that you're not going to have any more kids. You're not going to be pregnant again, okay? Because if you have your tummy tuck and then you get pregnant, everything's going to get stretched out once again. It's, you know, pretty, you know, the chances are high that you're going to have either a full secondary tummy tuck or a revision to that tummy tuck that you had before. The other thing that can you know, make things change is big fluctuations in weight, one way or the other. But if you have, say for example, you have your tummy tuck and things are, you know, about as tight as we can get, and then you lose, you know, 40 pounds, that skin's going to loosen up once again. Okay, so you're probably going to need another tummy tuck. So just the two important things to know as you come in for your tummy tuck is, number one, be fairly certain that you're kind of done with your family planning, that you're not planning on getting pregnant again. And number two, that you're at your ideal weight, you know, whatever weight that is, but at the weight that you think you're going to be able to maintain fairly reasonably, you know, the rest of your life.
I just had a tummy tuck, and I know I have to wait 6 months for my next procedure. When should I call for a consultation?
So, I mean, if you're already in our system, say you had a tummy tuck with me, and you're already in our system, then you just let your coordinator know through Clara. Just let her know you're thinking about your next procedure so they can start organizing that now, because as of right now, we're booked over 6 months out, okay? So you want to start organizing that right now. And the easiest way is to contact your coordinator through Clara. If you had your tummy tuck elsewhere and then you're thinking about doing a procedure with us, again, try to contact us probably as soon as possible. The easiest way to do that is to go to our website, okay? So www.pureplasticsurgery.com. You're going to see a couple of buttons there where it says virtual consultation, okay? You're going to hit that button and it's going to ask you for a whole bunch of information that you're going to fill out and also some photos, and then you're going to send that in, and our coordinators will get that, and then one of our coordinators will reach out to you within 3 to 5 business days, okay? Now, there's one thing I want to point out about that form. So that form is extremely important. It's the best way to really start the process here at Pure. But the one thing you got to know is that you have to fill out, in order for the form to work, you have to fill out everything that they're asking you for, okay? Every single box. Okay, if you leave a box empty, then the form's not going to go through. If you're not sure about something, then just, you know, put whatever options you have there, okay? But just fill it in with something, okay? And so that way you can actually get through to us. And then our coordinators can reach out to you, and then if there's certain details that need to be changed or whatnot, you know, our coordinators will be able to help you with that, okay? But it's very, very important that you get that form sent out. So you got to fill in all the boxes, you got to put in all the photos, okay? The photos do have a limit in terms of size, but it's a pretty large limit. It's something like, you know, don't put a photo that's over 50 megs, which, you know, is just ridiculous size anyway. So it's pretty reasonable in terms of the photos. Make sure everything's filled out. Make sure you check mark the CAPTCHA, you know, the I'm not a robot little sign there, and then that way that form will be sent to us. Our coordinators will then receive it, and then certainly within 3 to 5 business days they will then reach out to you through that contact information that we put in the form. And then, you know, if you need to, you know, add things, you know, or change some details, or, you know, whatever else it is that you need to do that the form say maybe was perhaps a little bit too strict for you, you know, then you can do that. So don't worry about that. But just get it filled out, get it sent, and then the process can get started.
How long after my first round BBL can I have the second round?
So yeah, so second, and I assume you're meaning second round BBL.
Yes, sir.
There's a difference there, okay? Sometimes when the word round is used, there's a little bit of confusion as to are you talking about the same surgery twice, or are you talking about 2 different surgeries, okay? So this will be a little bit more detailed in that answer. So say you had your BBL, and then your next round is your Mommy Makeover, then the wait is shorter. It's about 3 to 4 months, okay? But say you had your round 1 BBL and you want a round 2 BBL, okay? Well, then you have to wait about, the soonest that we could do it would be 9 months, and ideally it would be a year. Okay, because you never want to liposuction the same areas, you know, that you've done before in less than 9 months time, and if it's a year, even better. Why is that? Because there's too much inflammation, too much scarring, too much fibrosis okay? And it makes the liposuction a lot more difficult, a lot more bloody, okay? And there's less, and typically you can't remove as much fat because of all that scarring and fibrosis and everything else, okay? So it's really, it's not like a punishment or something like that. Don't think about it that way. It's to try to optimize your results and to do things as safely as possible. So round 2, whether it's Lipo 360 or BBL, needs to be done 9 months or later.
So I know we're talking about a combination procedure today, the tummy tuck with breast procedure and lipo.
Yeah.
And you've also explained this question before, but why can't you have a BBL plus a breast lift at the same time?
Right, so why not combine the BBL and the breast lift? Okay, so that's a good question. So number 1, that would not be considered a Mommy Makeover, right? So it doesn't fall under any of these definitions that we said here. That's a different combination. Why can't we do it? Okay, so there's a few reasons, all right? One reason is that recovery is extremely tough. So typically for a BBL, you're laying on your belly, right? Because you want to minimize as much as you can any pressure to the buttock and hips. And of course, with the breast lift, you should not be laying on the breast. You should be laying on your back, okay? So it makes that part of the recovery tough. You have to, you end up trying to get like zero gravity chairs and stuff like that. It's less than ideal. So that's one aspect of it. The second and more important aspect, especially here in Florida, is in terms of the limits that we have as to how much we can remove via liposuction when you're adding a procedure such as a breast lift. So according to the Florida Department of Health, when you're doing a breast lift, then you're limited to only 1,000 cc's of fat removal via liposuction. Okay, that's 1 liter. For most patients, that's not a lot. It's not enough. It's not enough for the removal aspect of it, and then you got to divide that in half. So 500 cc's for each, butt cheek, basically, which is typically not enough to create a huge change in the buttock. So again, it's going to be a less than ideal procedure. You're probably not going to be very happy with your lipo or your BBL, and so it doesn't make sense to do that. So really, the best thing to do is to separate those procedures, okay, so you can get the best and longest lasting results for each one.
Thank you. And now, what's the difference between regular tummy tuck, extended tummy tuck, and a mini tummy tuck?
Right, so those are the 3 main kind of options in terms of tummy tuck. The most common is the one in the middle, which is your kind of your regular or your full tummy tuck. That's what most people qualify for. The mini tummy tuck, it's called mini tummy tuck, but the incision, while it might be a little bit shorter in your regular tummy tuck, is not a short incision, okay? So it's a little bit of a misnomer in that sense. The incision is still going to be longer than a C-section scar. And typically it goes from like the little bone, hip bone you feel here, anteriorly or in the front, it goes from there, from one side to the other. So what makes it mini? What makes it mini is that you usually do not dissect anywhere above the belly button, that you do not release the belly button, and that you're not doing a muscle repair, okay? So there's very few candidates for that. That's really like the very specific patient who's pretty thin overall and just has that little bit of excess skin below the belly button that's really bothering her, okay? That's the candidate for the mini tummy tuck, okay? The regular tummy tuck that we described here is where you're having your incision hip to hip. You are releasing the belly button. You are dissecting all the way up to the xiphoid process, which is this little bone here, right here. Okay, you're doing that muscle repair as well. And so when you're doing all that, that's your regular tummy tuck. And then your extended tummy tuck is when you do everything that you would do with your regular tummy tuck. Okay, so once again, the belly button release, the muscle repair, the dissection all the way up. But you're also extending that incision now around the corner and towards the back, okay, to really get rid of some excess skin in that kind of flank area as well. So it's not just excess skin in the belly area, but also excess skin in the flank area, okay? So that's what's referred to as the extended tummy tuck. And you're, like I said, typically going all the way around and kind of along the back here.
How soon after giving birth can I have a mommy makeover, and when should I stop breastfeeding?
Okay, so Yes. You need to wait a minimum of 6 months, okay? But if you're breastfeeding, in order to do the breast surgery, okay, you have to wait 6 months after you stop breastfeeding. Okay, so what does that mean? So you have the baby, you want to breastfeed the baby for the first year, okay? Then you can't have your mommy makeover at 6 months, right? You got to wait till you're 6 months after you stop breastfeeding. So that's going to be a year and a half from when you have the baby. Make sense? So that's really the kind of the rate limiting step in terms of the the breast. So go ahead, breastfeed. Once you stop breastfeeding, then the counter starts 6 months.
6 months after breastfeeding.
Yeah.
Got it. Hello, I had a BBL and they put a big V on my butt to make the form on top, but they really put a wide V and now I have a big hole there. How can I make that better? It's only been 4 days after surgery.
Okay. Well, if it's only been 4 days, then there's definitely a way to improve that. So basically remove the V. Okay. At 4 days, things are very moldable, very malleable. Everything's going to change. So the fortunate thing is that it's only been 4 days. So what do? Remove the V, make sure your compression is placed adequately, and of course your massage. Your massage therapies can help tremendously to try to smooth out those areas that has formed from the compression of the V or whatnot. Okay, so the good news is that it's basically a short-term problem which should be fairly straightforward to fix at this point in time.
Do you do breast lifts with implant revision?
Yeah, certainly we can do that. So actually that's not uncommon. So a lot of times when you have your breast augmentation, it'll be when you're relatively young, say like in your early 20s, okay, and then after pregnancy and breastfeeding and all the changes that undergo to the breast, a lot of times what happens is that then the breast kind of falls over, and then you have an implant which is sitting here, and then the breast is kind of falling over. We call that kind of a Snoopy deformity or a waterfall deformity. Okay, and so in order to fix that, what needs to be done is usually an implant exchange with a breast lift. Okay, and that's not unusual. So yeah, we typically do that fairly commonly.
Thank you. My tummy is very flat. I had a tummy tuck many years ago, but I would like to see more contour. Can I do that with the flat belly?
Yeah, so definitely. So while this area right in the front here might be very, very flat after your tummy tuck, perhaps you have some excess fat in your flank and the waist area. Mm-hmm. So sometimes you can have a tummy tuck and still end up a little bit kind of up and down. And you want to kind of convert that to a more curvy look, a little bit more of an hourglass shape. Then a BBL can a lot of times help you achieve that. Because with the BBL, of course, we do the liposuction. With the liposuction, we can start to contour the trunk area. We can bring in that waist as much as we can. And then with the fat transfer portion of it, a lot of times we can round out the hips. And so when you have that combination of like bringing things in at the waist and rounding out the hips, that'll give you a curvier, more hourglass shape overall.
Any particular way photos should be submitted for consultation?
Yes, so definitely the best way to submit them is with either no clothing or minimal clothing, so that the point is that I need to be able to see the areas of concern, right? So they can't be covered up. So if you're submitting for some sort of breast procedure, then of course you can't have a bra on. Okay, that's not going to help me at all. So the breasts need to be uncovered. All right, so I need to see the area of concern so that I can actually evaluate the area and determine what's going to be the best plan for you. Now, we usually ask for at least 3 views, okay? But if you're doing the Mommy Makeover, then it's typically a straight front view, and then 2, side view, and then side view, okay? Now, if you're doing the BBL, of course, we also need the back view. So you can add the additional 4th photo. So it's going to, like I said, front view, the 2 side views, and we need that full, entire back view. It's best if you can send it where we can see, most of the body or all of the body, and not like something that's very like kind of zoomed up or focused in an area where it's very difficult to tell exactly what's going on. Okay. Another tip: do it with good lighting. Okay, don't do it in a dark place or a dark photo, and try to do it with like a relatively plain background behind you. if that's possible as well. Okay, so if you're able to do all that, it's really going to help me in terms of making a more adequate, a more accurate assessment, and then come up with your plan.
So after my BBL, how long do I have to wait to get back to my marital activities and take a good shower?
All right, so I'll take those are a little bit of a two-part question. So in terms of the shower, you can do that after BBL. You can shower next day. So for most patients, of course, they'll go home from recovery. They're gonna have that first night where you're just gonna have a lot of drainage. Drainage kind of comes from everywhere. It can get a little uncomfortable. And then the next day, you'll get up and then you'll be able to do your first massage. Okay. And by that point, you're probably feeling pretty gross, right? You had all that drainage. You had the creams and ointments and stuff from the massage. So typically, you'll do your first shower after your first massage, and then you can throw everything back on. Now, in terms of sexual activity, you have to wait 6 weeks.
Next question, a bit off topic, but by a future doctor, hopefully. What's the best way to pass the MCAT?
The best way to pass the MCAT. All right. All right. So, well, first of all, to be honest, I took the MCAT back in. So I started my school in '98. Okay, so it's been a little while since I took the MCAT. And back then, things weren't so digitalized, and there were those books basically that we had to study from. I'm sure that today there's some sort of digital method of doing it, but I would say that it's just doing a lot of questions, a lot of questions every day. Just make a plan, do like at least 50 or more questions a day, and then take a few Saturdays where you're doing like a half an MCAT or a full MCAT, just to get used to the way that they ask the questions and to the pace that you need to do for that exam, because it actually you actually have to move fairly quickly. You got about a minute, maybe not much of a minute per question. So you got to get used to that pace. And you have to get used to the way that they write the questions, which sometimes can be tricky because they're trying to kind of trick you into the wrong answer. And the last thing I would say is, if you're able to narrow it to 2, just pick one and move on. Okay, and don't get stuck. So you narrow it down. You're not sure between 2. Well, that's fine. Pick one, move on. Next question. That's
great advice. You should offer a tutoring service, Dr. Earl's tutoring. Next question. What type of lipo do you offer? Is it Vaser?
No, it's what's called PAL, or Power Assisted Liposuction, and the specific machine that we use is called Micro-Air. It's not the only one out there, but yes, we use the Micro-Air. It's a Power Assisted Liposuction, which means it's basically mechanical help that you get. The cannula moves front and back with a little bit of vibration, and that helps during the liposuction, makes it a lot easier to do the liposuction with that. But there is no energy imparted to the patient. So with the Vaser with a V, okay, with the V, the Vaser uses ultrasound energy, okay, ultrasound energy. So it actually imparts energy and heat to the patient, okay. And with the laser or smart lipo is the fancy name for laser lipo. It actually also uses a laser, which also imparts energy to the patient and imparts heat, okay? And so with those 2 modalities, you got to be careful, especially if you're doing a fat transfer, because if you impart too much heat, especially with the smart lipo, you can't do a BBL at all. With the Vaser, they say that you can adjust the settings maybe, but if you use too much energy, too much heat, you actually you melt away all the fat cells, and you kill all the fat cells, okay? Also, if you're not careful with those modalities, you can actually create a thermal burn to the patient, okay? A thermal burn to the patient. So we use the PAL, which I think is probably the best option, especially if you're doing a lot of fat transfer.
Thank you. Does the implants that you're currently using have to be replaced or exchanged down the road, or are they good for life?
So the ones that we're using nowadays, so 2020, 2021, etc., actually have a warranty for life. I'm talking about silicone implants, okay, not saline. So the silicone implants have a lifetime warranty, okay, and they do not have to be exchanged at any specific time unless it's some sort of specific issue with the implant, okay. So these are those kind of 5th generation gummy style implants, okay, and they're very, very durable. They're pretty hard to you know, to break or anything like that. You know, you can try, squeeze it, break it, it's good. You can probably even roll a car over it, and a lot of times it won't rupture. So they're made to last. They have a lifetime warranty, and you don't have to exchange them unless there's an issue.
Thank you. Is there an alternative to BBL if you just want to lift a saggy butt?
Well, are there other procedures out there? There are, yeah. So there's, you know, your kind of your surgical butt lift, but that means that there's a scar, an incision that goes over that top arch of the butt completely, right? So it's kind of like tummy tuck, but in the back. Okay, so you have that, and then of course the other option that is out there is butt implants. Okay, I don't do any of those procedures. Okay, I don't like butt implants, you know, because they have been known to cause a lot of issues with infection, extrusion, meaning when it kind of breaks open and pops out, or with what's called malposition, with the implant moving around. So I don't do butt implants. But there are surgeons out there that do. And what I would say is, you know, go to someone who has a lot of experience with it. That's definitely what I would do. And then for the butt lift, you know, some patients need it. If you're a massive weight loss patient, sometimes you will need that. Again, that's not something that I do, but there are surgeons out there that have the experience to do that. What I usually say, or what I have seen though, is that those patients that have the surgical butt lift, yeah, it works well to remove some of that excess skin, but they're typically then still not happy with the amount of volume that they have, and sometimes then they'll come back or they'll come to me to do their BBL so that we can then give them more volume with the fat transfer. Thank you.
I know you got to go soon. I feel like we're way past half an hour, but so many good questions.
Sure, let's do a couple more.
Can you get a BBL with 2 herniated discs? Second part of the question, or if you're diabetic.
Right, so if you're diabetic and it's well controlled, then the answer is yes. Okay.
Type 1.
The key parts of it, even type 1, is that it has to be well controlled. When you are diabetic, we will need some additional clearances. So we are going to need your endocrinologist to clear you. And we also need some additional labs, mainly your hemoglobin A1C, which needs to be below a certain level. If you're a type 1 diabetic, that means that we'd also need a plan from your endocrinologist as to what, you know, kind of insulin sliding scale you're going to have around the time of surgery, where you're being NPO, you can't eat or drink anything. So we're going to need a plan for your endocrinologist as to how we're going to need to manage you throughout that time. All right, and then the first part of the question was herniated discs. So if a herniated disc in and of itself is not a contraindication to BBL, so yes, BBL can be done. Now, you know, ideally you would have that fixed or repaired before you do your BBL. BBL, you know, it's definitely not going to make that problem any better. And initially, while you're recovering, you may feel a bit worse, you know, with all the swelling and the fluids and everything that's going on. Now, but do remember though, the herniated disc is way deeper than when we are with the liposuction with the BBL, okay? So the BBL liposuction is between the skin and the muscle. Also the fat transfer is between the skin and the muscle, okay? And your herniated disc are going to be deeper to that, you know, in your spinal cord, basically.
Thank you so much, Doc. We've had a few issues with connection, but the clean version will be saved and reposted. So you'll be able to see it in full. But yes, have some connection issues.
Okay, all right, so excellent. All right, well that's unfortunate, but yes, well we have everything basically recorded. So what I do recommend is for all you guys to go to our YouTube channel, okay? So go to our YouTube channel, it's a Pure Plastic Surgery, where you're gonna see all these lives, and they're kind of categorized by, you know, the different dates and also by the different topics. You can get a lot of great and reliable information there. Okay, everybody? All right, well, I hope you've enjoyed this, and I look forward to seeing all of you guys next week on Hump Day with Dr. Alex Earl. Take care, everybody. Ciao.